when I'm started right here, when I'm coming to you right here, I can walk in nothing. Well, I'm walking, but not like today. This knee can't touch nothing right here, because I got pain in me crying when I'm touching right here.
I remember too, you kind of had, like you were limping,
Yeah,
almost.
Yeah. And right now, almost 1 month after the chat, right now I'm feeling happy, happy. Because I'm tied on my shoes, I can't do like that.
You couldn't do it before because it would hurt so much.
Because I hurt my knees like that. And right now, my socks, I'm tying my shoes, everything.
So pretty much,
I'm happy.
yeah. I mean, how amazing is it to be able to have your life back, right?
Oh yeah, it's 100%. My life's coming back.
That's so awesome.
You helped me pretty good on this medicine like that.
And your shoulders are next, right?
Yeah, my next, I'm finished right here from my knees, and my next is the shoulder.
The shoulders,
Because
okay.
the shoulder is very bad right now too. I'm wait a little bit time.
Awesome. Would you recommend this for everybody, Aurelio?
Oh yeah. I really recommend the one friend.
Yeah, you did. You sent your friend to us, and she actually just got her shots not too long ago.
I think the next week coming another friend coming right here to you.
Okay.
Make an appointment and something like that.
Thank you so much,
give you
Aurelio.
the phone number and the address and everything.
Awesome.
Because I'm happy.
Nothing makes me more happier
yeah.
than to be able to see you like
the
this.
braces coming pretty good. The braces. I'm walking.
Awesome.
Nice.
Thank you so much,
Thank
Aurelia.
you.
You take care.
Hi Sharon, nice to meet you. And where did you get injected?
Colorado Medical Solutions last September
And where did we inject you?
in my right knee.
And how have you been feeling now ever since your injection?
It's taken a little time, but I have no pain actually in my knee joint itself. I'm able to do pretty much what I want to do. I'm still struggling a little bit with stairs, but that's normal even with surgery. So, but I'm very happy with the results. I will probably have another joint done at a later date.
That sounds wonderful. We're so glad we were able to help you. Thank you so much for this.
Well, I thank you.
Go ahead, Ronald.
Okay. I had a back surgery, and my legs just started to deteriorate. So
How long ago was the back surgery?
About 5 years ago.
Okay, so talk about what happened to your leg after the surgery.
Well, it just when my toes wouldn't lift and my foot wouldn't lift up when I was walking, so I had to go get a brace. So when I didn't stop my foot, you know. And
This is Barbara here. Barbara, can you show the brace that he was wearing? I see it right there.
Yes, right here. It goes into the shoe.
So he literally, just so I can be clear, he could not lift his toe. He had no toe lift.
Maybe just a tiny, tiny bit from the front, but now it's lifting towards the middle of the foot.
And you couldn't do any of that before.
no,
And so we did the stem cell injection, 30 minutes ago?
yeah.
And what happened right after the stem cells were injected?
Well, when she put that needle in there, it just shot right to my big toe, all my toes.
Okay. The sensation.
Yeah,
And that you didn't have for how many years?
5 years.
Wow. Wow.
See how it moves now?
And you can move now. You
Yeah.
can walk home without that brace.
Almost.
Well, pretty soon, we hope.
Wow.
I won't be stopping my foot no more.
Yeah. Wow. And there's so much that we look forward to with the stem cells decreasing the inflammation and initiating the healing cycle. I'm so excited for you. Thank you so much for sharing your story.
So I'm sitting here with Gary, and he's here to tell us about how great his injection is going. So, what part of the body did we treat for you?
My right knee.
All right. And what was your pain level on a scale of 1 to 10 before the treatment?
It was probably close to an 8 or so.
Okay. And what is your pain level at now?
It's probably a 3.
That's awesome.
3
Okay.
or 4.
So was your condition restricting you from doing any activities before?
It's starting to.
It was starting
Yeah, I
to.
couldn't do much walking.
How about now? Is it getting a little bit easier for you?
It's getting easier.
Great.
This last month is getting a lot easier.
Good, good. I love to hear that. Would you recommend this treatment to anyone else?
I would.
Yeah, great. Are there any activities that you're looking forward to doing now?
Getting around more and doing a little bit more walking and stuff.
Hanging out with friends and family a little
Yeah.
bit more? Good. So would you say that this change has been significantly more enjoyable?
Yes,
Yeah.
because I wasn't looking forward to no knee surgery.
Is there anything else that you would like to let future patients know?
Yes, I was skeptical at first, but I went to the seminar that they had and they answered a lot of questions, and I decided I'm going to give it a try.
And everything went well?
And everything is going really well.
Good, good. Well, thank you very much for sharing your testimony with us.
You're
We
welcome.
appreciate it.
Okay, it has been 1 month since I got the amniotic stem cells in my right knee. The amniotic. This has been such an ordeal. But look how I'm walking. Look how I'm walking. I don't feel the crumbling in the knee like the paper bag anymore. I feel zero pain right now. This is the dance floor, and I can dance. Well, I don't really want to dance too much. I can't really spin because I'm in my Vibram 5-finger shoes. That's a whole other story. Anyway, this is the Edie, the Salsa Freak, and I just have to say that I will, if somebody asked me, Edie, would you do it all over again? I would say yes. The amniotic stem cell way, not taking out of the bone marrow. That was hell, hell, hell. And it didn't work, okay? Using my own stem cells at the age of 53 did not work, but the amniotic stem cells did work, and I am just absolutely amazed. So, look at this. I want to run, but it's only been a month, but I'm holding myself back from running. I'm holding myself back from anything, really. And I just feel amazing. So anyway, if you guys ever have a choice, and if you want to get stem cells, I highly recommend the amniotic approach rather than the bone marrow approach, hands down. The experience, the recovery, the healing is 1,000,000,000% better than previous. And I think I'm one of the few people who have actually had both done. And I just have to say that the amniotic stem cells really did the trick. Okay, guys? So this is Edie Salsa Freak, walking, loving life. I can move. Nothing is stabbing me every time I take a move. This is awesome. Thank you, God, for a new lease on life. This is Edie Salsa Freak, signing out for today.
Okay, so, for years I suffered from horrible pain in both of my knees. I was like the bones, they're like bone on bone. And I was like a 9 out of 10, I guess is what they call it. 8 out of 10 in my right knee. The left is worse. And, I tried to play tennis. I'm an avid tennis guy. And it was just wrecking my life. So I went to an orthopedic guy, and he said, Jimmy, you got to get surgery on both knees. Bilateral, double knees, or whatever, I don't know, he called it something, but basically it boiled down to me, both knees whacked. So I was flipped out, because I'm only 48 years old, and now I've got to have bionic knees put in my body. It was weird. So all of a sudden, one of my friends told me about amniotic fluid injections. And I thought, well, okay, I heard a little bit about this, but not much. And I thought, I don't want the surgery, so I'll give it a try. And, I can't even believe it. I got injected. It took like 3 minutes. I couldn't believe it. I thought it was going to hurt. I'm terrified of needles. I didn't feel it. I didn't even know they did it, actually. And this was 13 months ago. And I haven't had pain, not 1 minute, for 13 months. In fact, the very next day after having the injections, I still can't even believe it's true. I didn't have any pain in either knee. It's been that way every day for a year and a month. So it's changed my whole life. I'm actually back on the tennis court and I'm excited about things. I can do things with my wife and my family. And I don't know, man, the injection saved my life. Oh, by the way, the surgery's gone. I don't have to do it. My knees are perfect now.
Hi, I'm talking to a patient that just had her 3-month checkup, Linda Loggins, and she came in originally for knee pain. Linda, can you tell me a little bit about the pain in your experience before you had your stem cell injection?
Well, I couldn't walk. I would use a cane. The pain was over the scale of a 10, and I probably should have used a walker, but I just wouldn't.
Yeah.
So trying to work and walk was very difficult.
Okay, and what would you say that the pain scale is now?
Below a 5.
That's awesome. Can you stand up and show us and bend your knee?
Absolutely.
I think that's more important to anybody.
Now, before I had the stem cell, I could get my foot about that far up in the back. I could not bring it any further because of the pain. I can, any of that now.
That is,
yeah.
that's
I could
great.
not do that before.
Well, awesome. Would you recommend someone else that has knee pain to at least look into this as a therapy before surgery?
Absolutely, absolutely. I came, it was so quick and easy. They gave me the injection and I was a little shocked that, okay, that's it, go home now. And I didn't even miss out of work that day. I went straight back to work after the injection, and then there's been nothing except the 3-month doctor appointment, and I'm able to walk and move now where I couldn't before.
I'm so happy for you. Now, how long did the injection take? Because people don't know that we don't do the adult stem cell where they're taking the bone marrow out. It literally is less than 10 minutes, and most people don't even believe. They go, can it be that fast? But it is, isn't it?
Oh, absolutely, it's that fast. There was nothing. It was just...
So no downtime.
No downtime whatsoever.
I'm very, very happy for you. And remember, we still have all that other time left for it to continue to grow and get better. So I'm very happy for you.
Thank you so much.
All right.
I was in a lot of pain, walking less and less, not going up and down stairs. I have to go up 4 stairs to get into my house, no matter which way I go. It's very painful. I had fallen a time or two. It would give out. Stopped walking the dogs. My husband had to do that all the time, not me. It was really affecting me. It's a whole lot better. I'm getting around, I'm starting to do more housework and all of that. Still don't like steps real well, but it's getting better. I just was given a brochure with more exercises I can do to strengthen my leg because it got weak from not using it too much. So it's much better. It took 2 weeks, and on the day of the second week, it was like, boom, I got up. Oh, it feels a lot better. I was a little bit afraid, not that I'm needle shy, because I'm not, and I'd had cortisone shots and they didn't do anything. But I just thought that this is different. I didn't know what to expect. There was a man here named Oliver that did the procedure. He numbed it with very small needles, and other than the needle that the stem cell stuff is in, is big. So I did feel it go in, but it wasn't as bad as cortisone shots. In my opinion, I only had one little tiny bruised place. So, I was very pleased because I was very, oh dear. I would, most definitely. I told the doctor earlier, it's the best money I've spent, and I don't have money to spend like that. I just don't. None of us do. Or there's a few that do, but there's a lot of us that don't. And I feel like it's the best money I've spent. And I'm just so grateful that I did pick this up on Facebook and have the courage to go to this seminar. I'm like, oh, this may be some fly-by-night thing. No, it's not. It works. And I'm just looking forward to those stem cells just keep doing their thing, and I can get rid of the brace one day and all will be well.
Alright, so I'm Debbie and I'm here with Linda, who had the amniotic tissue matrix injection to the low back a week and a half ago. So Linda, what condition did you get the amniotic tissue matrix injection for?
My low back.
And how long had you been suffering with that condition?
25 years.
And how does it feel since you had your injection 10 days ago?
Remarkable.
Nice. So can you elaborate on that a little?
I have absolutely zero pain, no stiffness, no muscle pain in that area.
And it had been bothering you for 25 years?
Yes.
So we just had Easter. You do big
Yes,
holiday
I did
dinners.
the
How did
holiday
you get
dinner.
through that?
I was on my feet for probably 2 days, for probably 15 hours each day, and didn't have to sit down, didn't have to take a break, didn't have to take any aspirin, nothing.
No, great. Would you recommend this procedure to others?
Oh my God, yes.
And did the amniotic tissue injection hurt?
Just very momentarily.
Okay. And what made you decide to do the procedure?
I didn't, surgery is not an option, wasn't optional for me. And I had to do something to try to prevent going on narcotics or anything to reduce the inflammation and pain.
Okay.
All right, so I'm sitting here with Horace, who had been suffering with a really bad peripheral neuropathy in his legs. And Horace, would you mind talking about how bad it was and then how you're feeling now after the stem cell injections?
Yes. Before the injections, I had problem sleeping at night because the top of my feet in particular, pins and needle sensations. And I would like shift around all night, and I did good if I got 2 hours sleep in the time I lay down to go to sleep.
Wow.
But after the injection for the stem cell, the pins and needle sensations, top of the feet, bottom of the feet, they're gone. Every now and then I get a false reading where my toes feel like they're cold, but to touch them, they're warm. So
You can feel them.
in
Awesome.
time, I'm thinking that that's going to go away as well.
Yeah.
So,
And it's been 4 weeks? 4 weeks, great. So we'll probably do another video with you in a couple months so that people can see the long-term progress, but this is very, very promising. And I thank you so much for sharing with us your experience. Thank you.
Hi, my name is Edie Williams, and I teach dance. I've been teaching dance for about 22 years now, and I believe that those 22 years of intense dancing, performing, going all over the world teaching really wreaked final havoc on my knees. My mom has bad knees, my brother has bad knees, my dad, it's just an inherited thing. I think after the age of 50, we were doomed to have bad knees. And so the doctors told me, after I got them both looked at, that, you know, I tore my meniscus, tore my PCL on my right knee, 90% cartilage loss on both knees, that I had to have them replaced. And that was just devastating. My life was hell. I could not teach. I had to get instructors to teach for me. I could only walk backwards down the stairs. I had to have 2 crutches to help me move. I'll never forget walking from my car to the doctor's office just in tears because it was so painful, just taking every step. Every step I took, I felt like there was a potato chip bag in my knees. And it was, I thought, I can't live like this, you know. My only option is to have my knees replaced. And then you have to have them replaced again after 10 or 12 years. And I thought, no way, I'm going to try something else, anything else at this point. And so I opted for stem cell injections. And after that, it just took one injection, first on my right knee, then a year later on my left knee. And I'm telling you what, I can run down the stairs now. I am playing basketball. I am going to the gym almost every day and squatting. It's amazing what this procedure does. The meniscus is completely regenerated, the PCL is regenerated, and the cartilage is growing back. Now I know that's so hard to believe, but it happened to me. And from a dance instructor, you know, that could barely even walk, to now I'm teaching, I'm performing, I'm working out every day. It's unbelievable. I mean, just to give you an idea, I mean, just getting out of the chair, okay? I mean, I can go down, no problem. I can run. My knees, it's as if God is giving me a brand new lease on life, you know. I am so thankful for this procedure. I'm so thankful that Dr. Jones said, Edie, let me help you, because he literally saved my life. I don't know what I would have done if I didn't have the stem cell injections. My life would be a lot different now if this was not a possibility. So thank you.